we live in a day and age where everybody has high deductibles. We have high out-of-pocket costs. We, are really looking at our financial well-being. What can I afford? And so that's how we decided to step into this world of cost of care conversations. And so you can see the different buckets of our project that we're trying to work with, and utilizing Choosing Wisely as our basic foundation, as that engagement with patients to improve health outcomes, to have that two-way conversation as part of shared decision-making, and then providing these 5 broad areas for improving cost of care conversations as a build on to Choosing Wisely to deal with how much does it cost. So we looked at what do we need to have for tools for education and engagement of providers in the practice team. How do we garner these conversations? How do we move these conversations forward? Who's doing it across the country as best practices? Looking at tools and resources to support these conversations, which I'll go into minimally today, but happy to go through these more in-depthly with people if you're interested. Looking at clinical workflows. How do you incorporate the concept of having these cost of care conversations into your clinical workflow, trying to make it the right thing, the easy thing to do, so to speak, looking at what you're already doing in your clinical setting. The training, what do we need to put together for that training opportunity? And then looking at synergy and scaling so that we can make this a sustainable opportunity within the practice setting, within the health system. So as I may have indicated before, I just really want to emphasize that this is all about patient-centered care. It's about building shared decision-making and incorporating cost decisions into that. I think if we look around, many of us go, I am kind of doing that already, so how can I improve it and make it more sustainable throughout the entire system or the practice setting? It's about engaging patients and aligning with their preferences. We've talked about these things. It's part of shared decision-making, and it's not only about their personal preferences, but looking at financial well-being for better healthcare decisions, for a more improved health outcome. Costs are considered for a patient and consumers. I don't think I can afford that, so I'm not really going to adhere to it and follow through. And so we asked our pilot practices, really, what are you already doing? Because we know in many cases they're already doing it. They just don't call it cost of care conversation. That's just not been part of the language. And so and many times we say, well, can you give us a little bit more information if a patient does ask by chance about how can I find out more information on the cost of the treatment that you're recommending? How can I find out more information? And in some of our practices, they have what they call care coordination coordinators, patient navigators, and it's really their process of already being a patient-centered care mindset, and that they want to help their patient as much as possible to get the care that they can afford, that they can find out more information, and transparency to cost comparisons and what might alternatives be as part of that shared decision-making discussion. So the evidence behind why, this slide, I hope that you'll take some time to take a look at it when you have more time, but I just wanted to pull out 2 of the articles, because I don't know how many of you have had conversations or looking at research behind cost of care conversations, but it may strike you like, well, I don't know if I was trained to do this if I was a provider, or as a patient, I don't want to ask my provider how much does it cost. I would be embarrassed, or I think that would be rude. So we've done some focus groups that kind of give us an idea of where people are in the spectrum. You have generational differences, you have, training differences. So just keep an open mind when you're looking through some of these articles on the research behind it. But this just points out why it's so important to add cost of care conversations and integrate those into your shared decision making.